बिस्मिल्लाहिर्रहमानिर्रहीम। रब्बी इश्रह ली सदरी व यस्सिर ली अमरी वहलुल उक़्दतम मिन लिसानी यफ़क़हू क़ौली। अल्लाहुम्मा इन्नी अस्अलुका इल्मन नाफ़िअन रिज़्क़न तय्यिबन अमलन मुतक़ब्बला शिफ़ा मिन कुल्लि दा। Obstructed labor. Definition: Obstructed labor can be defined as a labor where there is poor or no progress of the labor in spite of good uterine contractions. Incidence 1 to 2% of the referral cases in developing country. Maternal condition. Causes. When we say causes about the maternal conditions, that is the fault in the passage. When we talk about the labor, there are 3 P's: passage, passenger and power. So as far as the maternal condition is concerned, there is fault in the birth canal. Number 2, contracted pelvis. Number 3, abnormal pelvis, that is android, anthropoid, pelvic tumors, fibroid, ovarian tumor, tumor of the rectum, bladder or pelvic bone. Number 6, abnormality in the uterus and vagina, stenosis in the cervix's vagina, that is the canal is not open, neither the cervix is open or the vagina, they are closed. Contraction ring in the uterus, vaginal septum, that is the short curtain in the vaginal canal, rigid perineum. Fetal conditions, that fault in the passenger, macrosomic baby, that is good size large baby with the big head, malpresentation, malposition, posterior occipito-posterior position, transverse lie, malformed babies, that is the hydrocephalus, when there is water in the ventricles of the skull, fetal ascites, conjoined twins, twins which are joined together, cord around the neck, and locked twins, the twins which are blocking the ways in the passage birth canal. Diagnosis. Partogram will recognize impending obstruction early. If the labor is slow to progress, careful general abdominal and vaginal examination is necessary. Woman gives the history of prolonged labor and the labor pain becomes severe and frequent, and bearing down is also difficult. Examination. General examination. Features of the maternal distress, that is the exhaustion and ketoacidosis, dehydration, tachycardia more than 100 per minute, raised temperature more than 100 Fahrenheit degree, scanty urine. Abdominal examination. The retraction ring, that is the Bendel's ring, is seen and felt between the tonically contracted upper segment of the uterus and the distended, tender and stretched lower segment, distended urinary bladder. Fetal heart sound shows evidence of the fetal distress or even absent. You see in this picture here, this is the fundus of the uterus, lower part of the uterus, and in between there is constriction ring. Because of this, the shape of the abdomen, you can see it's changed. It's not like that. No. Here again in this obstructed labor, there is comparison of the normal labor, how the uterus changes is upper segment, lower segment, and here the thinning of the lower segment of the uterus, which is called as effacement again, and the upper segment it becomes little bit thick and shorter also. In obstructed labor, you can see the uterine changes. Again, here the thinning of the lower uterine segment and thickening of the fundus, but in between two there is a constriction band, that is called as the Bendel's ring. And here again on the abdomen how it looks like. Vaginal examination. The vulva usually swollen and edematous. The vagina is dry, hot, and occasionally offensive and purulent discharge. The cervix is almost fully dilated or hanging like a curtain. The presenting part is extremely molded and jammed in the pelvis. There is usually large caput formation. Caput formation, it is the bulging of on the skull, which is the most presenting part, and this usually dissolves within 1 week after the birth. Preventive. The management includes the number 1 is the preventive, then is the curative. In preventive, we see the proper assessment of the pregnant woman during the antenatal care, regular antenatal care visit, proper assessment in early labor to detect the cause if any. Partograph have to strictly follow. That is the graph which shows the changes in the labor. In the labor room, we draw it with the time, the changes in the cervix, contractions of the uterus. We record the vital signs in the liquor color, and we all note in that graph. It shows the whether the labor is going smoothly or it is lagged behind. Then we have to take the action if there is alert line is there. Prompt follow appropriate treatment to solve the problems. Curative, that is immediate management, general management, and obstetric management. Immediate management, correct the maternal dehydration. Contraction prevents by tocolytic drugs, that is the drugs which decrease the pain of the uterus, and blood sample sent for grouping and cross-matching. General management, assessment of the vitals of the mother and general condition. Intravenous fluid to correct the dehydration. Broad spectrum antibiotics are given, and usually it is given after test dose. Catheterization, Foley's catheter is to be passed. Sodium bicarbonate infusion to correct acidosis. Obstetric management. Number 1, delivery of the fetus. Number 2, in the delivery of the fetus, number 1 part is the vaginal delivery. Destructive procedure is only done when there is fetus is dead. If the head is low and vaginal delivery is not risky, forceps examination, forceps we usually do, and extraction may be done in alive fetus also. Number 2 part, cesarean section. Alive fetus, then we do the cesarean section. Over-distended lower segment with impending rupture, even the fetus is dead. Active management of the 3rd stage of the labor. Number 3, continuous bladder drainage for 2 to 3 days to prevent the vesico-vaginal fistula. Complications. Complication in the maternal and fetal, that is the rupture of the uterus, vesico-vaginal fistula, recto-vaginal fistula, postpartum hemorrhage, puerperal sepsis, shock, and maternal death. Fetal complications, it includes intrauterine asphyxia, intracranial hemorrhage, neonatal infection, acidosis, and fetal death. Now is the prolonged labor. It could be the part of the obstructed labor also. When the labor tends to be prolonged for more than 18 hours, both in primigravida and multigravida, is called prolonged labor. Cause is again in fault in passenger, passage, and power. Hypotonic uterine contractions, when the uterine contractions they are not powerful. Uncoordinated uterine contractions, constriction ring, and cervical dystocia. Diagnosis is based on the history, age, parity, duration of the labor, duration of the membrane rupture, whether the patient was handled outside the hospital by dye or in unhygienic condition, whether she was treated with oxytocin drugs outside the hospital, previous history of difficult labor, instrumental delivery, or stillbirth, that is the death during labor, during delivery. General examination. Height of the patient, dehydration, acetone smell, that is the fruity smell, pallor, raise in temperature, again more than 100 degree Fahrenheit, tachycardia, more than 100 per minute pulse, and decrease in blood pressure. Abdominal examination, we have to see the contour of the uterus, presentation and position of the fetus, that is tenderness, again frequency, intensity, and duration of the uterine contractions. These should be, uterine contraction should be rhythmic, and the intensity should be mild to moderate, and again leading to the moderate and then severe in the 2nd stage of labor. Lower segment distended or not, distension of the bladder, and fetal heart sounds. Vaginal examination, the vulva usually swollen and edematous. The vaginal is dry, hot, and occasionally offensive and purulent discharge. The cervix is almost fully dilated or hanging like a curtain because it is not properly being effaced as it should be. The presenting part is extremely molded and jammed in the pelvis. There is usually large caput formation. It is the swelling on the skull, the most dependent part of the skull, because of the compression of the birth canal on the skull of the fetus. Differential diagnosis, constriction ring, full bladder, fundal myoma. Fibroid on the fundus of the uterus, it also seems to be like this if you palpate on the abdomen. Management. Number 1 is the general management. That is the keep the patient NPO, nothing per oral, and IV fluid start immediately. Bladder evacuation should be done, in-out catheter should be used. Parenteral antibiotics, I told you before that always give the antibiotics after the test dose. Intake output chart should be strictly maintained. Urine should be examined for albumin and acetone. Blood should be sent for grouping and cross-matching. Obstetric management during first stage, the role of oxytocin, hypotonic uterine contraction is good because we can give the syntocinon. Role of sedation, in case of incoordinate uterine contraction, we can use the pethidine and phenergan can be given, which can lead to spontaneous correction. Role of artificial rupture of membrane in the hypotonic uterine contraction is also good. Role of pentose is good in occipito-posterior position and fetal distress. Role of cesarean section, contracted pelvis, big baby, malpresentation, malposition, and severe fetal distress. During second stage, role of episiotomy, rigid perineum. Role of forceps, fetal distress, that is deep transverse arrest, posterior, persistent occipito-posterior position, cord prolapse in the living baby. Role of ventouse in the deep transverse arrest, occipito interior position, occipito posterior position. Role of C-section, contracted pelvis, big baby, malpresentation, malposition, severe fetal distress. Role of destructive operation, craniotomy, decapitation, evisceration only when the fetus is dead. Now, complications. Fetal and maternal, both complications. In the fetal complication, immediate there is fetal trauma, birth asphyxia, fetal distress, meconium aspiration syndrome, stillbirth, neonatal death, late, that is cerebral palsy, mental retardation. Maternal, immediately maternal distress, increased operative interference, maternal injury, postpartum hemorrhage, puerperal sepsis, maternal death. Late, that is urinary fistula, vaginal stenosis, Asherman syndrome, secondary infertility. And with that, thank you. I hope my lecture will help you in your study and in your exams.